Restoknee Hospital presented world's largest MRI knee cartilage regeneration data at Asia's biggest orthopedic and radiology conference in Ahmedabad. This reshapes the future of knee restoration. We have presented the world's largest MRI data on cartilage regeneration, leading a breakthrough in knee preservation. We take great pride in sharing that Dr. Jawahar Jetwa was the only Indian faculty doctor presenting this research to top experts from around the world.
So thank you very much, organizer, for this opportunity. So my topic is healthy cartilage regeneration post-implant less HTO, that is high tibial osteotomy, MRI and functional evaluation. So we are studying this. We have not completed a study, but it's a report which is regarding to whatever has been said with the stalwart speakers before. So I'm going to talk about the articular cartilage, which we already have learned a lot in the previous. There are various methods. And then what about the relaxometry and cartilage mapping, methods of high tibial osteotomy, implants and implantless, and some of the data of these 202 patients where we have some results, some inference, and some clinical outcomes, and at the end, our concluding hypothesis. So we all know that has been very well explained that there is a superficial zone and all these zones, but very important for us is this yellow line, which is a subchondral bone, which is very important to support the articular cartilage, distribute the mechanical stresses across the joint, and provides nutrition. Now that portion is very important for us about the subchondral bone, and these are the basic aspect where we can see that the status of articular cartilage can be not only with this imaging but pain scores, movements, gait, functionality, imaging, histology, and biochemistry. So we can correlate with the clinical symptoms of the patient. So there are various methods of finding out what is the status of articular cartilage, which is very important for any of the surgery, which is not only for the chondral defect. So there are number of things which are available with X-ray, CT scan, histology, and some mechanical testing like indenting and shear testing, and also clinical scoring with arthroscopy, molecular. But what is very important for this all documentation is that when we want to work for the detailed reporting, the images, scores, and biochemical data and the functional results are very important. So as all these speakers have said that there are advantages of T2 mapping, which is qualitative, non-invasive, early detection, zonal evaluation is also possible correlated to the function. It's versatile. So now we are going to talk about the relaxometry, which is very well explained, but the numbers of relaxometry which we have found out in our cases, which is very important. But how it is influenced by the water content and the collagen fibers organization and more degenerative cartilage, which will raise the T2 value. So what we have done is that before HTO, we have to find out that there was a high T2, and after HTO, we found that there is a reducing towards the normal. That was very interesting. And similar is the another paper which says that yes, it is very important T2, but it is also combined with other methods where we can give more comprehensive evaluation of the regeneration by this. So there are various methods of upper tibial osteotomy, high tibial osteotomy for the degenerative osteotomy medial compartment. So all these osteotomy which are maybe closed or open wedge with various types of methods, these are the osteotomies which are fixed with the implants. But what we have studies is the osteotomy which is implantless. So it is a patented patient-specific external brace which maintains the correction. So at Restoknee hospitals, which was invented by the late Dr. Sharad Oza, we have now more than 1,000 cases with all these data and couple of publications on this. So what do? We take the preoperative X-rays, we go with all these parameters, documentation, we make a 3D model, then we do a closed wedge osteotomy according to these angle which is required, we check postoperatively, and we give immediate weight bearing on the next day with this particular splint, and afterwards, after 4 months, 4 weeks to 6 weeks, we give a short brace, and then we have a complete dedicated physiotherapy for follow-ups, and also we go with the documentation. So what has happened with this from 2019 2024? We have now collected all these data, which are of 94 parameters, which includes various pain scores and movements and T2 mapping and CT imaging and functional scores, also gait analysis. So all these things have been checked up of these 202 patients, and we know that normal value of T2 is around 50. Now, typical report of a radiology is like medial compartment cartilage thickness that has been checked preoperatively, postoperatively, and then medial compartment cartilage thickness with the anterior, middle, and posterior both, and we could see that how much it is increased from non-measurable to 1.7 to up to 1.3, like that. So these are the ways by which we are getting the radiologist report, which is also the two different institutions and two different radiologists giving this. Like in the lateral compartment cartilage thickness, we know there is not much difference because we are doing and concentrating on the medial compartment syndrome. Similarly, we have found in the patellar cartilage thickness, there are areas of cartilage regeneration along with medial patellar facet that also we have found in our study. And with the CT-MR altogether, there are a good cartilage reformation that has been reported, which is very interesting that when we go with the relaxometry values, which are from anterior part, middle part, as well as from the posterior part, and we could see there is a significant improvement with these relaxometry values on the medial femoral side, medial tibial side, and not much of the lateral side. But this is a typical report. As compared to preoperative CT MRI, there are good cartilage reformation showing smooth contour and good relaxometry values after HTO, which is like hyaline cartilage, which is very important for us to understand by this so many cases. And similarly, our findings for the relaxometry, which we have done for the medial femoral, medial tibial, lateral femoral, lateral tibial, for the anterior aspect, middle aspect, as well as the posterior aspect, and we could see there is a significant increase in the cartilage thickness and cartilage T2 value, which is most importantly relaxometry value. And we also have got the gait analysis of 154 patients where we have found out the FFD in lateral position, FFD in AP position, then the speed and the condensed, all these things. And we have found out that average improvement in the motion was from 103 to 114, that is the flexion. And we have up till now up to 1.5 years, that means 18 months of follow-up, where we have got this type of pain scores, functional scores, and cartilage thickness on medial and lateral side, as well as the relaxometry on the femoral side, as well as on the tibial side. So as our speaker said, that it is continuous process. After even 6 months, the regeneration is increasing, and even up to 18 months it has increased. So, and we have used this knee society score, Ortho toolkit, for the pain scores. So we would like to see what happens with the patient. This is very important. So high intense activities, those patients who are able to do must be having a good cartilage. As Tirak said, that it is irrespective of the cartilage mapping on the radiological this thing compared to what happens with the patient. Patient is able to do without much of the pain, and this is very important for us to understand. Of course, it is with the good physiotherapy and motivations. We also have a develop a gait sense type of an instrument by which we see the gait analysis, and we have found that after 6 months the kick gait data compared to the healthy individual is also very important. It is almost similar pattern we have found. So it is a new thing where you ask the patient to kick a ball and you try to find out what happens with the kinematics. That's very important. So in the discussion, as there is a one paper which shows that the T2 mapping revealed no qualitative improvement indicating the regenerated cartilage was predominantly fibrocartilage, non-hyaline cartilage, where we think it was because there was an implant used. There was a subchondral support which was given, which is supposed to be hanging and supposed to be cushioning. And so open wedge osteotomy, microfracture enhances cartilage repair morphological, but does not restore to normal cartilage or a native hyaline cartilage. And similarly, we have found out that the the implants which are in the near subchondral bone can have a mechanical defects which can affect all these parameters which are very important, and in the long term you might have to require to remove the implants because you want there is no metal inside. So we are very happy to find out that with this kick movement we got from the internet, this kick kinematics of Ronaldo is a very popular football player, and we found that whatever was the pattern of his kicking, we found similar pattern, of course, of the lower strength, but a similar pattern when we found out this type of kinematic study with the gait, and this was very interesting for us. So, friend, in conclusion, MRI T2 relaxomatrin cartilage mapping is a non-invasive and a preferred method to study status of the cartilage, which we all know by now with all the speakers. Implant-less high tibial osteotomy shows comparable radiological and functional outcomes. So not every time we require implants. And subchondral bone plays a major role in stress distribution, stress shielding, and continuous healthy cartilage regeneration, which is also very important. High tibial osteotomy with implants near subchondral bone may be negative effect, may have a negative effect on regeneration of the cartilage. And implant less HTO shows good quality and hyaline like quality of articular cartilage, which has been reported by the radiologists at the two different institutions. And definitely we require to know or go more studies on this to find out the damaging effect of implants in proximity of the articular cartilage when we perform high tibial osteotomy. So thank you very much for this opportunity. Thank you.